How many like Spanish-speaking patients do you see coming here?
I would say about 15% of them don't only speak Spanish.
Would there ever be times when there's no interpreter available?
We would probably tell the patients to reschedule until we can find someone that can speak Spanish.
You get people all the time who've just moved to the country who don't speak any language, anything other than their native language. And you end up trying to be like, ow, does this hurt? And like you kind of have to learn how to read the body language in the face.
So then, do you speak a little Spanish?
I can read it. I'm good at reading and translating. Speaking, it's like a nightmare. I like. Did you ever see Inglourious Basterds? So it's like that. So I'm like, donde está?
Yeah, what the heck?
I'm not really that bad, but and a lot of times if I'm talking to somebody who has trouble understanding my English, I will be like, "Are you walking?"
Okay, yeah.
You know, like I do that. I'm like, "Does it hurt? Does this hurt?" Like, it's a lot easier to get externships and jobs if you know multiple languages, and I've noticed that having done hiring and interviewing and stuff, like it's
including residency.
Yeah, like it helps. It doesn't. You don't think it's like that much, but that could be the one thing that sets you apart from your doppelganger. The one thing.
Okay.
If you don't know how to speak Spanish, you should definitely get somebody in your practice that does know how to speak Spanish, so you can have somebody that translates. Okay. Or let your patients know that they need to bring a translator with them.
Do you know any Spanish?
I took 5 years of it in high school, but I'm like there. I was like, "Do you know Spanish?" I'm like, "Un poquito," and then they start speaking, and I'm like, "Hang on a minute, let me go get."
If you were first year at podiatry school again, would you like take some time to try and learn it?
Yes.
Yeah, I think I would. I mean,
knowing what we know now, I think
yeah,
we both would.
It's important.
Okay. Can you say something to motivate like my classmates to learn Spanish?
Learn Spanish!
It's a lot easier than having to like run around the clinic trying to find somebody that knows how to speak Spanish.
Yeah, okay.
So it's a lot more time, time convenient than having to go.
Do you only get the non-Spanish? Because I get like everything other than Spanish.
I get everything. People that just don't understand what you're saying.
Even people who speak English that don't understand what I'm saying.
Oh, you want to video it now?
Yeah.
Okay. How long can you video it?
I can video for hours.
Hours? I'm talk a minute. I'm talking a minute.
Okay.
All right.
Dr. McGuire, can you tell us about how the Spanish language affects your job as a healthcare provider, maybe how frustrating it may be, or how you deal with it?
Actually, it depends on the area that you practice in. Here in Philadelphia, we have, at this location down here, we have probably, 20-30% of our patient volume is Hispanic.
At least.
At the other office, it's actually a little higher, maybe 30 to 40% of the patients that we see up there speak Spanish. Now, not all of them require an interpreter. Most of them have various levels of English, so we have this struggle to determine what's actually wrong with the person. Okay. We're lucky enough to have a lot of staff around that can interpret for us. It's one of the great negatives of my life that I never learned Spanish. I actually took the wrong language. I took Latin, which did not help me at all. So no, I'd recommend now learning either at least medical Spanish, if not enrolling in a course and taking Spanish, because it's just the second major language in the United States at this point. And you're going to, almost wherever you go, you will treat a large percentage of your patient population is going to be Spanish speaking.
How imperative would you say is it for us first year podiatry students to take the time to try and learn Spanish?
Oh, I think you're crazy not to.
Okay.
Everybody should do it. Now I know most of the students won't, and I know it's hard. I mean, I've tried to do an online program to learn Spanish, and it's very difficult to try to teach yourself Spanish. I do pretty well when I go to Spain. I've been there a number of times lecturing, and I lecture with an interpreter, and I know that once I'm in that country for a whole week, by the end of the week there's a lot of Spanish I've picked up already without doing any study at all. So if you can do some time abroad and do some time in a place where you really can't hear anything but Spanish, and maybe have somebody to help you out a little bit on the side, you actually will learn it very quickly.
Can you say something to motivate us to try and learn Spanish?
What, more than you absolutely should do it? And, well, let's put it this way. If you're in an area, say you were down here and you had an office that was in Chester County, or in the kind of a northeastern part of Philadelphia where there's a large Spanish population, you would be cutting off half of your economic input. Like half of the patients that might come to you would come graciously and quickly if you could speak Spanish, but they'll automatically seek out a physician that knows their own language. So you would lose. I mean, you would not have as busy an office as you could if you don't do that. So.
Okay. Thank you, Dr.
You're
Mogwai.
welcome.
Dr. Sinzer, do you have anything you'd like to add to that?
I'm going to let her add.
See.
Buenos dias.
Well, I think that, you know, one of the things that Dr. McGuire was saying is true, that it does help. And it's not just from the medical aspect, but from the cultural perspective as well. So it's important, and I see it from a different perspective, being able to speak to them in their own language, but also knowing and being a proponent for them being here for many years, also starting to learn the language to be proactive in their own health care, because not every physician they go to, from specialist to primary care, is going to know the language. So it's kind of a give and take. For me, it's exciting because I do have family who may have at some point in time not gotten the care they needed because there wasn't somebody who could speak their language. If you're looking at two applicants who are actually equal and par on both areas, but one is bilingual in Spanish or even has a basic comprehension, has taken that couple of those steps to learn that, and that residency happens to be in a very large Spanish population, Hispanic population, the option for the residency director is more than likely going to be to the person who has at least some foundational tools.
Okay.
It's always going to help in any sort of job, knowing another language. And from Spanish, you will. I mean, Dr. McGuire said he learned Latin. That's the root of a lot of the Romantic languages. So I can understand Italian, I can understand Spanish, there's some French I can understand, and Portuguese, just because they're all intertwined. So it's definitely helpful, and as the years go, I think that it'll probably be a greater edge and almost a prerequisite for professional schools for you to have that basic understanding in language. So kudos to you guys for doing it on your own. There's been a lot of things I've heard through the years, both residency and also in private practice, where large things have been missed because there was no translation. Infections have been missed because there really isn't an understanding, and there's only so much you can get from just an evaluation.
Can you say something to motivate us to study it for our first year?
Habla. With every chance that you get and any opportunity, lose the pride, lose the embarrassment, and I had to do it. I had to literally lose the pride factor of not knowing the grammatically correct way of speaking the language, and just kind of immerse myself and try. It's a trial and error. And just like Dr. McGuire was saying, the more you hear it and the more you use it, the better you're going to be. So if you have an opportunity to be around people who speak the language, just start speaking it. Even if it's the first time you're seeing the patient, they speak that language, practice a little bit. And you know, with Spanish being one of the largest languages spoken in the United States, and in some states actually the primary language, it is really something that you would be doing something detrimental for your own practice in the future if you don't start to have a foundational understanding.
Okay.